YouTubers. Welcome to my series, Dr. Mohan Explains. As a practicing endocrinologist, I've spent the last 20 years teaching my patients about the wonderful but often confusing world of our hormones, how we measure them, monitor them, optimize them, and what it all means if you happen to be diagnosed with an endocrine condition. Here, I wanted to give you inside information on topics that come up over and over again in my clinic. So let's go in with my very first video. This one is about biotin. Patients with thyroid disease I see often look a little puzzled when I ask them almost out of the blue if they're taking biotin. We're talking about their thyroid condition, maybe they're fatigued, maybe they're struggling with weight issues, and all of a sudden I throw them a curveball about biotin. Well, today you'll find out why this commonly used supplement could be influencing your thyroid and other blood tests. By the end of this video, you'll know exactly what to do so that biotin supplementation that you're taking won't adversely impact your test results. So let's get started. So what is biotin anyway? It's actually one of the 13 essential vitamins. It's also called vitamin B7, sometimes called vitamin H for Haar and Haut, or hair and skin in German. It's a coenzyme that attaches to various other enzymes in our cells and allows these enzymes to function in metabolizing fats, carbohydrates, and proteins. There's plenty of biotin-rich foods out there. They're found in high levels in liver, egg yolk, fish, and meat. If you're plant-based like I am, there's plenty of plant-based sources, including seeds, sweet potatoes, nuts, oats, legumes, peanuts. Peanuts are very rich in biotin, soybeans, and vegetables such as broccoli, spinach, avocado, and mushroom. Of note, raw egg whites are nature's biotin blockers. Avidin, which is a protein in egg white, binds to biotin and prevents us from absorbing it. When you cook eggs, this no longer becomes an issue. So make sure that you don't drink your eggs, but cook your eggs in the morning, unlike Rocky. Biotin deficiency, well, this is actually not so common. We don't need that much biotin every day. Only 30 micrograms per day is all that we need. So it's really rare to be biotin deficient. Most of us get somewhere between 35 to 70 micrograms per day on most types of diets. Symptoms of severe deficiency, which occurs in malnutrition, include dermatitis, imbalance, muscle weakness, neurological symptoms, skin infection, in children, developmental delays, and weakened immune responses. So these conditions are severe and not all that common. But certainly biotin deficiency can cause hair loss and brittle nails. These symptoms are very, very common in the general population, which is why we find a significant increase in the use of biotin supplementation. Hair loss and brittle nails, very common, difficult to treat, so we think about supplementation. Definitely the supplement industry has increased sales of biotin over the past several years. In the 1990s, only about 0.1% of Americans were taking biotin supplementation. Now, 30 times as many take this supplement. It's much more commonly used in women than in men, and often more in older age groups than younger age groups. The doses are used that are quite high, over 1,000 times the daily adequate intake. So why has biotin supplementation increased anyway? Well, we all want long, luxurious, healthy hair, and we want strong, beautiful nails as well. So certainly the industry has trying to meet these consumer demands. But physicians also tend to recommend biotin for their patients. In a survey of 300 dermatologists, 66% said that they would recommend dietary supplementations to help patients improve their skin, hair, and nails. Still, there's actually limited data on whether this all works or not. Certainly, the patients with severe biotin deficiency may benefit from biotin supplementation, but there's very little data on hair and nails, yet it's still commonly used. Well, at least it can't harm us, correct? Well, not necessarily. The problem happens when people who are on biotin go to a laboratory. So they're handed a lab slip, they go to the lab to get their blood drawn, and maybe they took a biotin dose that morning or the night before. And it turns out that this might have an influence on the patient's test results. So now we're going to go into a little bit about what happens in the laboratory when we submit our specimen and how the use of biotin might influence those results. So what you see here are two samples. The sample on the left is a patient who is not on biotin, and the sample on the right is a patient who's on biotin. And what we're going to be measuring is a hormone called TSH, which is labeled here. And TSH is one of the hormones that we measure all the time to check a person's thyroid function. So here we have a patient with TSH in their bloodstream, and here we have a patient with both TSH and biotin in their bloodstream. So the biotin is depicted here as this little green diamond. But look here, there's also biotin in the laboratory. In this case, this biotin is attached to an antibody, which is a protein made out of from mouse cells. So this biotin is attached to this antibody, and there's another antibody here as well. This antibody has a little signal, almost like a flashlight on the end of it. This signal can be measured. The light emitted from that little signal can be measured, and we'll see how this all plays out. So the patient's, so here is the biotin both from the patient and from the laboratory. So what happens is the patient's blood is incubated with these antibodies. And during that period, the thyroid hormone gets bound to an antibody with a biotin. That's one part of the sandwich. The other part of the sandwich is the antibody with the little signal or the light that can be emitted from the end. So you have this TSH sandwich with two antibodies, biotin on one end, and this light signal on the other. Now this is floating in this sample, and all of the TSH hormones are being bound in this way. Now we want to be able to capture these sandwiches so we can measure how much TSH is in the sample. The way we capture it is with a protein that lines the bottom of these tubes. And this is a protein called streptavidin. Streptavidin happens to have a little receptor on it, which firmly attaches biotin. This is actually one of the strongest bonds in nature, is this bond between this receptor and biotin. So now this streptavidin has captured and bound this entire sandwich with TSH in the middle and this little signal on the end. So all of these receptors can now be potentially filled and or capturing these sandwiches. But what happens, remember, this patient is already on biotin, so there's plenty of biotin in this person's blood, and now that biotin can actually bind to the receptor. And if it's bound to the receptor, these sandwiches can't bind to that. These sandwiches get washed away. So at the very end, you can see in a normal person, there's plenty of measurement of TSH here. All those little points of light can be measured, leading to a normal TSH. But on this example, many of these receptors are filled with the patient's own biotin, which leads to a low level of measurement or a falsely low TSH level, which can have some significant consequences. So it turns out biotin can influence many labs. As we just saw, it tends to lower TSH values. T4 and T3 levels, though, tend to be increased. A different type of assay used with biotin leads to falsely high levels. So if you have a combination of low TSH and high T4 and T3, that's consistent with an overactive thyroid or hyperthyroidism. We're going to talk much more in a future video about how to interpret thyroid function tests, but low TSH, high T4 and T3 would be translated into too much thyroid hormone. PTH, parathyroid hormone, something we commonly a measure in our clinics tends to be low with biotin use. Troponin, this is a heart enzyme that's found in heart muscle. When a person has a heart attack, this enzyme goes up because that leaks out of the heart muscle into the bloodstream. With biotin, though, we might get a falsely low troponin measurement. Very serious, because if a person having a heart attack happens to be on very high doses of biotin, the troponin result might not be valid. It may actually show it to be normal. Same thing with HCG. HCG is the pregnancy hormone, and biotin, high doses, could have a potential to cause HCG to be low. So here we might have a person who's actually pregnant who checks their test either through urine or through blood and may end up with a false measurement, falsely low measurement, and may actually look like they're not pregnant actually. And there's actually many more different laboratory tests which are influenced in various ways by biotin. So hey, this is how this may play out in a patient's case. So a couple of years ago, an author published a case report of a patient who previously was not taking biotin and had perfectly normal looking thyroid levels. Then they took biotin and they presented with labs that looked like hyperthyroidism. Now, the physician was kind of questioning those lab results because the patient didn't display any symptoms of hyperthyroidism. And on a close questioning, it turned out that the patient was taking high doses of biotin. They discontinued the biotin and repeated the labs only about 6 days later, and you can see that they completely normalized again. So if it was not known that the person was on biotin, they may have been assumed to be hyperthyroid and have had a lot of additional testing and potentially even treatment. So it could have been a disastrous result. Fortunately, it was detected and the labs were repeated off of the treatment. So how long does it take for biotin to wash out of the system? Well, it depends on the dose. So most people take somewhere between 5,000 to 10,000 micrograms per day, or 5 to 10 milligrams per day. And at 10 milligrams, 10,000 micrograms, it looks like before about 8 hours, after about 8 hours, it's fully washed out and no longer has an effect. But if a person took that on the morning of the blood draw, that might, of course, have some effect on the results. Very, very high doses take even longer to wash out. So you can see here, very high doses might take up to 72 hours to wash out of the system. So I tend to ask my patients, since I don't know exactly how much they may be taking, to wait at least 3 days, 3 to 5 days, to be sure that biotin has washed out and is no longer having any impact on the test results. So what are the takeaways about biotin that you should be aware of? Well, it's an essential vitamin. It's needed in relatively small quantities. It's found in a variety of foods. True deficiency is actually quite uncommon. However, there's been a skyrocketing use of biotin, mainly for hair, skin, and nails, despite lack of very strong scientific data that it's actually useful for this. High doses found in supplements can interfere with thyroid and other blood tests, parathyroid, thyroid, cardiac tests, and others. So it's very important that we all recognize this. We need to keep in mind that this biotin is not interfering with the actual hormones. It's not actually interfering with the function of these glands or organs. It's actually a laboratory error that occurs if biotin is present. You should all inform your physician if you happen to take biotin, because the interpretation of the labs may be influenced by that knowledge. And certainly it's important to hold biotin at least for 3 days ahead of all laboratory testing. I want patients to spread the word about biotin. It turns out that many physicians may not be aware that biotin has this influence on lab tests, and it's important that we spread the word about how it can influence results. I want to thank you for watching my program today. Look for more to follow. Make sure that if you liked the information that you received, to like this video and to produce any comments that you want at the end. including topics that you might like me to discuss in the future. Thank you so much.